Hi, I'm Mel and this is Chandrika, and we would like to welcome you to our fourth webinar in our wellness series. Before we begin, I would like to acknowledge that this webinar is being held on the traditional lands of the Noongar people, and we pay our respects to them and their cultures and to their elders, both past, present, and emerging. So this is our fourth wellness webinar, and we've devised this series specifically for people with metastatic breast cancer. And the series itself is looking at the role of complementary and integrative therapies and how they may help with some of the symptoms, side effects, and issues that can occur as a result of living with metastatic breast cancer. The webinar that we're doing today is going to look particularly at adapting to altered appearance. And this is quite a big topic for people living with metastatic breast cancer because they often undergo a number of treatments which can affect their physical appearance. This can include surgery, chemotherapy, radiotherapy, endocrine therapies, all that can directly impact on a person's physical appearance. And that can be quite distressing for people as it can be a real visual sign of their disease. So today we're going to be looking at the complementary and integrative therapies and also psychosocial interventions that can help the way that people feel about their bodies and ultimately improve self-esteem. So we will just go to the learning outcomes for today. So by the end of this webinar, we hope that you will be familiar with breast cancer related appearance changes, understand definitions of body image and body image distress, be familiar with the evidence for lifestyle strategies, including nutrition and exercise, and be familiar with evidence-based psychosocial interventions and complementary and integrative therapies for improving body imaging and lowering appearance-related distress. And just a little bit about us. So facilitating today is myself, Melanie Rowley. I'm the metastatic breast care nurse here at Breast Cancer Care WA. And I'm joined by Dr. Chandrika Gibson, who will be presenting on this topic. I've worked at Breast Cancer Care WA now for the last year, and I really enjoy my role here. But a little bit of my background before that. So I qualified back in 2004, back in the UK in London, and I started my career at the Royal Marsden Cancer Hospital. So I've always worked in oncology. I spent a number of years there working on a variety of wards, both surgical, medical, and also palliative care wards. And I completed my postgraduate diploma in cancer nursing at that point. I moved to Australia in 2009, and since being in Australia, I've always worked in oncology and in a variety of settings, both clinics, wards, and the community, caring for patients undergoing chemotherapy, radiotherapy, immunotherapies, endocrine therapies, and also in palliative care settings. Presenting to us today, we have Dr. Chandrika Gibson, and she has worked extensively with people diagnosed with cancer since 2006 in a variety of roles, including the Cancer Council, Cancer Support WA, Solaris Care, and now with us at Breast Cancer Care WA. Chandrika combines her understanding of psychosocial supportive care and complementary and integrative therapies with her skills in writing and research to create and evaluate programs aimed specifically at reducing distress in people impacted by cancer. She has a number of formal qualifications, including an advanced diploma in naturopathy, a master of wellness. She's also a senior yoga teacher, a yoga therapist, and has recently completed her doctorate. Much of Chandrika's research has also been published in high impact peer reviewed journal, and there's no better person to present on this topic today. And without further ado, I will pass over to Chandrika. Thank you very much.
Thank you so much, Mel. It's always a pleasure and an honour to work alongside clinicians such as yourself who deliver incredible support to people with metastatic breast cancer throughout the whole illness trajectory. And so, yes, I am passionate about this topic. And one reason why I'm passionate about it also is because of my own lived experience with altered appearance. You may or may not be able to see clearly on the video that I have extensive scarring to my face, and that's due to skin cancers. I've had about 30 surgeries. So, while I'm not a breast cancer survivor or patient myself, I do have a little bit of understanding about some of the impacts personally from alterations to your physical appearance. So that kind of sets the backdrop, I guess, of our formal and lived experience expertise. Let me give you some definitions of the topics we're talking about today. First of all, what is body image? Probably we all imagine that we know what body image refers to, but it's quite a nuanced science, actually. It's this multifaceted psychological construct, which includes the way that a person perceives their own body, not just the way it looks, but also the way it functions. So, alterations in function can cause body image distress as well. Body image is inclusive of the kind of physical, psychological, and emotional changes that can go on, including thoughts, feelings, and the associated behaviours that might stem from those thoughts and feelings, all of which reflect the relationship we have with our own body. A big part of healing this relationship with our own body is befriending or maybe refriending a body that might feel like it's changed unrecognizably or that it has betrayed us in some way. So we'll get to some of the treatment approaches, interventions, and personal empowerment strategies later. But first, we'll talk more about this construct of body image. So the aspects that make up this construct include perceptual. Things like body dysmorphia might come into this, where your accuracy or lack thereof, if it's dysmorphic, estimation of your body size relative to the actual space that you take up on the planet. It includes attitudinal aspects, so whether you're satisfied or dissatisfied, or maybe neutral about your own body. Affective refers to emotion, feelings that we associate with the body. And if you think about it, emotions are very much held and stored and felt in the body. So it is a kind of mind body experience. And the cognitive beliefs, including how invested we are in our appearance. You might think that body image distress only affects younger women or only affects women who perhaps put themselves out in the world as being particularly physically attractive, but that's actually not necessarily the case. Older people, men, everybody can experience body image distress. And then there are the behavioural aspects of body image. So, body image and things like disordered eating are often linked together in mainstream media type articles and also in research. They're not always connected though, but they can be. So, compensatory behaviours, perhaps it's things like dressing a certain way, putting on makeup, wearing wigs, dieting, exercising, trying to alter one's body dimensions or body appearance. As I mentioned, body image distress is pervasive. It can affect anybody, whether you identify as a man, a woman, a non binary or queer person, and including children. In fact, children very young have been reported as wanting to change the shape or size of their body. A 2021 survey done by Liptember, which is a women's mental health group foundation, found that 38% of Australian women are currently battling body image issues. And I would guess anecdotally that that might be a little bit of an underestimation, actually. I think it affects a lot of people a lot of the time. And then we have breast cancer as something that impacts this body image. So already we're sort of swimming in this soup of appearance and its importance societally. And then we have breast cancer and the changes that diagnosis and treatment bring. Living with a chronic illness of any kind can be associated with lasting body image challenges. The way that you view yourself, the way that you feel about yourself, the way that you behave can all be affected. We might not have an exhaustive list here, but these are some of the body changes that might impact someone with breast cancer. First of all, there's the direct change to the breast itself, perhaps mastectomies or lumpectomies, or a change in other ways to the appearance of the breast. There's the scars, again, some more visible than others. Lymphedema, which is a swelling of a limb related to the removal of lymph nodes, typically in the armpit in breast cancer, and then the arm on that side may not be able to drain its fluid effectively, and the arm swells and looks visibly different. And when it flares up, can be red and hot and irritated and very, very uncomfortable, which alters function. So there's an appearance change and there's a functional change. There can also be nerve damage, which causes pain or numbness in the chest or arm related to treatments including chemotherapy and radiotherapy. The loss of hair during active treatment is quite common, and not just the hair on one's head, but also eyebrows and eyelashes and body hair. And when it does grow back post those more intensive treatments, sometimes it grows back quite differently. And so that can be a really dramatic change in someone's appearance. Some people feel that they are, really known for their hair. Their mane was their pride, perhaps, or even if it wasn't, it still means that they're less recognizable as the person with the identity that they had before cancer. Our bodies change naturally as we age, but breast cancer seems to speed up these processes. It's very common for weight to change, whether increasing or decreasing. There can be a change in body composition, so a loss of muscle mass, and an increase in adipose tissue, and a general sense that your body shape has been altered by treatment. Another kind of functional aspect of body image is how we identify ourselves as parents or parents to be. Our fertility can be impacted by diagnosis and treatment. For many people going through hormone related breast cancers, menopause is medically induced and comes on very fast and sooner than it might otherwise. And this can result in a whole sequelae of physical changes, appearance related changes. There's a dryness of the skin, a dryness of the hair, a dryness of the vagina, and there's a whole raft of other issues, increased risk of cardiovascular disease, loss of bone mineral density. These can all affect one's body image. So it makes a lot of sense then, with all of these changes to the body and changes to the self image, that libido might be affected, whether that is a direct side effect of a treatment or a kind of accumulation of all of these different factors. There can be a loss of interest in being sexually intimate with another. There can be pain during sex. And the vast majority of people experiencing breast cancer do report some degree of fatigue, this kind of overwhelming tiredness. Again, there's lots of factors that play in to fatigue, but it means that you feel different about your body and what it can do. The amount of activities that you might do in a day might have changed. And some people living with breast cancer as a chronic illness refer to themselves as spoonies. This comes from an idea of the spoon theory that someone living with a different chronic illness, someone living with lupus, came up with, and it kind of went viral because it really explains how our energy might change, that we might have to kind of ration our energy on a day-to-day living basis because things are much more tiring than they used to be. We have reduced stamina. So I think you can get a sense then that form, function, and psychosocial factors are all influencing this altered body image. So, this study was a qualitative study that I thought you might find interesting. It's called Body Image in Women Diagnosed with Breast Cancer, a Grounded Theory Study, and the lead author is Jennifer Brunet. And so when they surveyed a number of, I've forgotten the exact number actually of participants, but a reasonable number of people with breast cancer, they were able to thematically analyse the themes that came out of the interview data. And these themes really express these different perceptions, attitudes, and feelings that might arise related to body image through the breast cancer experience. First of all, there's treatment related events like losing a breast or both breasts. There's the changes in weight that we've mentioned, discrepancies between one's actual weight and one's desired or previous set point. Weight gain or weight loss and physical deconditioning all go along with that picture. Scarring from surgeries, reconstructive surgeries that may give a slightly different or very different appearance to the breast area. The second theme that was drawn out or identified in these interviews were that psychosocial factors can either undermine or they can be supportive of body image. So the stage of life that you're in does seem to have an impact. Your overall well-being, so whether you've got other kind of positive things going on in your life, your perspective, whether your body image, your appearance is important to you or not. And it seems that there's this kind of cumulative trauma that often happens in our cancer experiences if you'd had early life body related experiences. So, some other kind of trauma to your body image will kind of compound when you have your breast cancer body changes. But a supportive aspect is when you receive compassion from others. And that's why it's really important that we all understand these changes and the way that it can impact someone, so that as friends and family members and health professionals, we can also be supportive of the person with breast cancer. And for yourself, if you're a person with a diagnosis, to offer yourself some compassion wherever possible. The third theme is the sociocultural factors that undermine body image. It's really clear to people whose body image or whose appearance gets altered that the world judges us on our appearance. And for all of us, we swim in this same soup of beauty myths, and we internalize beauty ideals and weight biases and weight stigma. In a separate piece of research done in the last 12 months or so, health professionals have been found to have a great deal of weight stigma, to treat people in less normative bodies differently. There may be people who comment on your weight, and I think generally people are getting better at not making appearance related comments to each other. I think in the kind of zeitgeist, it's becoming apparent that even if you think you're giving a compliment, it may not be a compliment to note that someone has gained or lost weight or changed shape or changed appearance. So people receive this in the kind of sociocultural environments that they live in. And that makes them feel self conscious. Even if no one says it directly, they might feel like people are looking at them. It might feel like, yeah, their different appearance is noticeable. Things like going through the checkout at the shopping centre, things that we all have to do on a semi regular basis. If you've just lost your hair or if your body has dramatically changed, you don't want the person operating the checkout to comment, and usually they won't, but there's this self consciousness that arises. Another theme that came out in this work was that people have a repertoire of strategies. And so this is really important, this kind of research where we actually ask people living with the experience, how do you cope? What do you do? What works for you? And there were both behavioural and psychosocial strategies that people reported. Behavioural strategies included getting more physically active, and I'll talk more about the research behind that shortly. Some people did focus on managing their weight and their nutrition by focusing on their caloric intake, whether increasing or decreasing, and focusing on nourishing themselves really well, which can be an expression of self care. But we must be careful as well that controlling calories and focusing on healthy foods can go to an extreme and become disordered. And so, what the participants in this research noted was that they did allow themselves occasional indulgences. There was some balance to this focus on food. Other behavioural strategies were to conceal their appearance changes. In terms of psychosocial strategies, people worked to get beyond a physical appearance, to either become for themselves less superficial or to encourage others in their environment to make meaning from something that isn't appearance related. Self compassion came up as a repertoire of strategies that people found for themselves, whether they were taught it formally, perhaps in counselling, like we do here at Breast Cancer Care, or maybe they discovered for themselves that a way to feel better about their changed appearance was actually to be kind about it to themselves. To reject diet culture, to reject beauty culture, to say, that's not important to me, and move in a different circle, perhaps, be around non judging and accepting people. For many people, the passage of time does change this experience. We are able to adapt in some form. We get used to these changes and they become less central in our minds. But there are still consequences of body image distress that it can affect our intimate relationships if we no longer feel comfortable being touched or touching or being naked, that we withdraw from social settings, particularly in those circles where appearance might be valued more. And that can send us down a kind of negativity spiral of isolation. But equally, if we can manage it using some of those strategies, it can change our lives for the better. There is a potential for some kind of post traumatic growth. So, focusing in on the metastatic breast cancer experience, body image has been studied quite a lot in women with early stage breast cancer, but less frequently in people with metastatic breast cancer. And that's a shame, really, isn't it? Because, there's so much going on, and Yeah, this is an under-researched and under-focused on area, but it is a source of a great deal of distress for some people. So, one of the few in depth studies in metastatic breast cancer was a 2015 cross sectional study with 113 participants, where the researchers aimed to identify the factors that affected quality of life in this sample of people with metastatic breast cancer. They paid particular attention to body image, as well as disease site and time since diagnosis. So their findings were, the results were, that the time since diagnosis and the location of any metastases were found to affect people's quality of life. And most strikingly, this differed for people with higher and lower body image. So it seems that body image remains really influential on quality of life, even for those living with a shortened life expectancy, which is a really powerful reminder that we need to make sure that there are quality of life support interventions that more carefully consider the metastatic experience and the unique body concerns that affect this population. So, what really is this body image distress? Do we all have to love our bodies at all times? Is that even possible? Well, the way that it's depicted in research is as a kind of continuum where our relationship to our bodies kind of shifts along this continuum, and it might change. If you're menstruating, it might change with menstrual cycles, or with age, it might change with life phases, or with surgeries and treatments, it might change, or with exercise and different strategies that you put into place, it might change. So, at one end of the continuum, we have this very negative relationship to our bodies where we hate our bodies, body hatred. A little bit further to the center, but still quite distressing, is this idea of body image distress. We don't feel good about ourselves. There can be anxiety, depression, embarrassment, etc. In the middle, there's a kind of preoccupation with the body that's not quite negative, not quite positive. It may be neutral, it may drive lots of body centered behaviors, but it's still taking up a lot of space in our minds and in our hearts and in our experiences. Then moving to that more positive approach to our bodies, there can be a state of body acceptance. And perhaps this is something that we are, seeking, is to be okay with things as they are without needing to alter them. So can you get a sense of that slight difference between being preoccupied, wanting to change your body, and then having acceptance of the body as it is? And even more powerful would be a sense of body ownership, to be really peacefully embodied in the skin that you're in the shape that you're in, allowing it to change and living your best life no matter what. That would be body ownership. But it's complicated, of course. It's not simple, and we might move up and down along this continuum, sometimes having positive feelings towards our own body, maybe working on some appreciation for how it feels. I said to my colleagues earlier, setting up for this, that my legs are really sore because I started lifting heavy weights, and that's a kind of appreciation for me. I get that physical sensation that reminds me, oh, I'm getting stronger. I can do something difficult like lift heavy things. So that can help sometimes and give us a more positive sense of our body, even if the outward appearance hasn't changed. But equally, we can fluctuate and we can go into those states of negative feelings. Maybe it's time to get new clothes, or we're getting naked for some reason in front of a new partner, perhaps, or an old partner, and there's a feeling of being disgusted or embarrassed about the appearance of our body. So we can move up and down that continuum a lot, and lots of things influence it. So maybe rather than seeking to be body positive all the time, maybe the ideal is body neutrality. And there is a movement out there. And if you're on social media a lot, maybe you want to curate your feed so that you're getting more messages about body neutrality, people with diverse and different bodies living their lives, doing things that matter to them, rather than focusing on things that look aesthetically pleasing, or kind of self hate messages that can be out there. In the intro, Mel mentioned, the impact on self-esteem. And yes, appearance and self-esteem can go highly together, can be quite closely linked, but they're actually separate psychological constructs. So this is where your own values come into play. If it matters to you, then it matters, and it will alter your self-concept when your appearance is altered. So, self esteem is linked to this self concept. It concerns the attitudes or feelings of satisfaction we have with ourselves based on evaluation of our characteristics. And so, part of this webinar, I hope, is a reminder to you that you are more than just how you look. You're not just a physical body, you have a mind and a heart and all kinds of things going on. Your life is multifactorial. And so, if we can evaluate other characteristics, not just physical appearance, then that can have an impact on self concept, which has an impact on self esteem. But that's not to minimize how distressing it can be to have an altered appearance in a world that seems to really value, particularly for women, but not solely for women, for men and for queer people as well. There's a lot of messages, a lot of cultural associations. And when it comes to breasts, the idea of femininity is very linked to our breasts and this beauty ideal for women being healthy, young, and symmetrical. That's what people think is the ideal, and that's not the reality anymore. We do want to give some attention and awareness to men with breast cancer. Though there is a much smaller number of men affected, men do have breast tissue and they get treated quite differently. Breast reconstruction surgery is uncommon. It's not often offered to men. And so men are then left without a nipple, without an areola, and they will also experience chest asymmetry and scarring. There were some qualitative interviews done in 2022. The research article is called A Scar for Life: Male Breast Cancer and the Experience of the Post-Surgical Body. It's a fairly small qualitative study with 16 participants. The men varied in age from 25 to 78. And overall, they revealed that their body image was really damaged, related to a perception of a body that's been altered and violated by this experience. The way that the men in the study managed their experience of altered appearance was using different concealment practices, keeping tops on, not disclosing, not allowing people to see. And so they had a great deal of dissatisfaction with their bodies following breast cancer surgery. And it's something that doesn't get as much media attention as women's breast cancer, doesn't get the spotlight shone on it. And this is important, that body image distress for men is also acknowledged by healthcare providers, and that perhaps they should be offered breast reconstruction or conservation surgeries so that they can make an informed choice. So, what happens when we have this drastic alteration in our appearance? Well, the psychological kind of context or the psychosocial context is that people have a lot of different strategies to cope, one of which is avoidance. And partly why we avoid things is fear. So, this is the kind of psychosocial context that we're thinking about. There's your own values around appearance, there's your history of how you viewed your body in the past, there's the other life events besides the cancer life events, which are many and varied. And then there's your own fear of a changed body and fear of the attention, the negative attention it might get, or the uncomfortable, awkward reactions of others. So, one of the ways that we might deal with it is just to avoid, to try not to be seen, to try to, isolate ourselves, to avoid doing things that we used to do. And so this creates its own kind of cascade of problems. There's a lot of different health outcomes related to social connection. And so if we isolate ourselves from partners, from friends, from hobbies and activities that we used to care about, this can be really problematic. So instead, the idea might be that we try to confront our own fear. We try to lean into it. I know this is a lot easier to say than to do, but if you think back to that theme that arose in that bigger body of research, time helped. So the passage of time might help you adapt because you've got this longer exposure So instead of avoiding the mirror or instead of avoiding, seeing yourself unclothed, long exposure to the disfigured or altered parts of the body and also long exposure to social situations make it feel more normal. We do adapt, we're incredibly resilient. We get habituated into living with the way that we look. It becomes normal to us. And we might develop slightly different skills if we lean into the fear of social rejection. We might find that our social interaction might even be enriched. And this predicts future coping for us. So we do become more resilient to all of the stressors and strains that come with metastatic breast cancer. And this can increase self efficacy, a feeling that we can do things for ourselves, and our confidence and our social integration all can be improved by this. But for people who find it really difficult, and we understand that that is quite normal to find it really difficult, people who experience this greater body image distress and dissatisfaction, and who do then lean into the avoidance approach, tend to have poorer overall health. They use more painkillers and psychotropic medications. They experience higher levels of anxiety and depressive disorders. Fatigue increases, and perhaps this is to do with not doing so many activities. When quality of life is measured with questionnaires, the scores come out lower. Sexual functioning difficulties are reported, and social isolation is reported. In my own PhD, which looked at people with head and neck cancer who have visible changes, visible scarring, some of them had, noses removed, so a little bit different from the breast experience, but some similarities. The things that the participants in my research talked about were that they really weren't prepared. They found that the focus in terms of their medical treatment was on survival and not so much on preparing for altered appearance. Mel tells me, the metastatic breast care nurse who introduced this webinar, she tells me that this is better handled in breast cancer typically, that there is more thought put into aesthetic results, and that preparation for body image changes is kind of built in the breast cancer experience, which is really good. But even so, you might still feel unprepared. You've taken in a lot of different information, and so these unexpected alterations in appearance, like your weight changing, losing your hair, skin redness from side effects from radiotherapy and chemotherapy, as well as the extent of the surgery, sometimes you really can't know until you're in the depths of the process. Some of the distressing consequences that my participants reported was not being recognised by friends and family and acquaintances, not recognising themselves. They talked a lot about the first time they saw themselves in the mirror, and that's called in the literature a mirror trauma, and that they struggled to adapt to their altered self concept. And if they had done an activity in the past that meant something to them, that was valued in their lives, that related to their appearance, that was no longer possible for them. And that created a great deal of distress. So I think we've touched on a lot of these appearance altering treatment side effects, but to go in a little bit deeper to the changes in weight. Well, initially, weight gain is quite common. In a survey of 309 Australian women, about two-thirds reported weight gain after breast cancer treatment, and the average amount they gained was 9 kilos, which is probably a dress size or two. For most of these people, that weight gain occurred during the first 1 and 2 years post-diagnosis. But of course, weight loss and loss of muscle can also happen for some people. Most survey respondents, almost 70%, gained in excess of rates expected in healthy age-matched controls, because we know that as we age, there can be natural weight gain, like around the menopausal years. But in this case, with breast cancer, almost 1 out of 5 gained more than 20 kilos. What can we do about weight changes? Well, of course, everybody says calories in, calories out, move more, eat less, but it's really not as simple as that. And particularly when you've been going through a trauma, such as breast cancer treatment and living with metastatic breast cancer, it's really not as simple as that. However, Still, lifestyle interventions might help to manage your weight. And if they can't change your weight, they can perhaps help the way that you feel, that relationship with your body. There are a number of barriers to taking up a lifestyle intervention, to changing your exercise or changing the way that you nourish yourself, including that treatment side effect we mentioned before of fatigue. That can really put a dampener on trying to get fit and strong. There can be a perceived lack of time, a lack of motivation, and because of the increase in anxiety and depression, it just may not be a priority. It may not be as simple as it sounds. In fact, the research shows that less than a quarter of people with breast cancer maintain their regular physical activity long term. Lymphedema. Here's a nice illustration for you if you're not already familiar with the axillary lymph nodes under the armpit. These are sometimes the sentinel lymph nodes that are removed because they are potentially a place where breast cancer can travel. And so they're removed in surgery, usually along with mastectomy. And this can cause, immediately or much later down the track, lymphedema. So, conservatively, 20% of people treated for breast cancer are likely to experience secondary lymphedema. It is most common in the first 12 months, but it can happen anytime, including many years down the track. It can occur after treatments when the lymph nodes are removed or damaged by radiotherapy. It might affect the arm and or the chest. There are some self-reported outcome measures like the lymphedema symptom intensity and distress scale for the arm, which when women with breast cancer related lymphedema were asked to rate the intensity and distress using this scale, there were some interesting findings. So they noted that body image and sexuality concerns were really common. Almost half had body image concerns, and more than a fifth, 23%, had sexuality concerns. The participants were asked to score on a range of 0 to 10 their intensity and distress related to body image and sexuality symptoms. When the numbers were crunched, the statistics were regressed. There was a greater intensity of sexuality concerns associated with younger age. So you might recall we said earlier that, life stage can have an impact on body image, but it's not always the case that younger people have more concerns with sexuality. In this case, that was the trend though. And distress related to sexuality concerns was also associated with higher interarm bioimpotence ratio and shorter duration of lymphedema. So, worse symptom picture and having it as a newer change. So, again, time passing can help with adaptation. Body image concerns weren't directly connected to any other factors, but they did affect nearly half the people with breast cancer related lymphedema. This was a study, an Indian study about mastectomy. There were 165 people involved, and following modified radical mastectomy, there were high rates of depression, anxiety, and distress, affecting about a third of participants. 92% reported body image disturbance. And for breast cancer survivors who had completed active treatment, they were more likely to have body image disturbances within the 12 months post active treatment. Of course, in metastatic breast cancer, treatment might be ongoing, and so that's a slightly different picture. In this study, body image disturbances weren't associated with younger or older age or with other forms of psychological distress. They stood alone in affecting 92% of participants. Reconstruction following mastectomy is widely considered to improve your quality of life and improve body image and sexuality. However, there's a lot of factors involved in this as well. Things like sensations will be altered, appearance will still be altered. Some people do feel better for having a mastectomy. However, there are some who choose, sorry, a reconstruction, I mean, there are some who choose not to have that done. And there is that possibility of remaining flat. Different types of breast reconstruction will give different appearance outcomes and are chosen for lots of different reasons. Implants made of silicone or saline are inserted under the muscle onto the chest wall, or you can have latissimus dorsi flaps, so that's using a muscle from the back moved to the chest, including fat and skin tissue. They might also include a breast implant to get the kind of shape and size that the person might have had before. There are tram flaps and diep flaps, different surgical choices for reconstruction. Sometimes fatty tissue and muscle is taken from the buttocks or the hips as well. Another way to make the appearance of reconstruction look a little bit more natural is nipple tattooing. Plastic surgeons and their staff can perform medical tattooing in both public and private healthcare settings, but many will acknowledge that it's actually tattoo artists who can create the most natural looking areolas and nipples. The tattoo artists use these special three-dimensional techniques that look really good. Pigments can be chosen to match your remaining nipple or your previous nipples. Over time, these pigments might fade or change, so you might need to have tattoos touched up if that is a choice that you're making. Health insurance doesn't always pay for medical tattooing, particularly if it's done by a tattoo artist rather than a plastic surgeon. Another choice might be prostheses. So, as everybody is different, prostheses are available in a whole variety of shapes, sizes, cup sizes, and skin colours. They'll have different amounts or layers of silicone so that you can try to match again the structure and the kind of natural movement that would have been there prior to mastectomy. You want to look for one that's close to your original breast shape and that suits your lifestyle, and there are professional fitters that can help guide you through the range available. As I said, though, there is the option to go flat, and this is becoming quite a social movement. A growing number of people are foregoing reconstruction, and they report that they're satisfied with their choice, especially if they have the support of their surgeon. This was a study published in 2021 called Going Flat After Mastectomy, Patient Reported Outcomes by Online Survey. It was a good idea to do an online survey in 2021 when most people were online. There were 931 women who had a history of either uni or bilateral mastectomy for treatment of breast cancer or elevated breast cancer risk. So it might have been a prophylactic mastectomy for some of them. 73.7% chose mastectomy alone. And the reasons that they gave for going flat, for not having reconstruction, was faster recovery and not wanting something put in their body that isn't of themselves, a foreign body. Then we have the menopausal changes, and we have done a webinar in the past, and there's a lot of great content out there about the menopausal changes that can go along with hormonal treatments. The many recognized symptoms of menopause are both mind and body symptoms. They can include those vasomotor symptoms like hot flushes and night sweats, vaginal dryness, reduced libido. Bone and joint pain is perhaps an underestimated cause of suffering through the menopausal transition. And mood changes. There can be a great deal of heightened anxiety, and for some people, depression and cognitive changes too. A kind of brain fog that is akin to chemo brain, whether you're on chemo or not. It can be due to hormonal blockers, hormonal treatments. So we've mentioned that sexuality can be linked to our body image distress, and in particular, the impact that an altered appearance might have on intimate relationships. It's another area that probably doesn't get enough attention when the focus is biomedical, but our relationships matter and they give us support and resilience in many ways. So, for bodies that have changed, sometimes drastically, it can be tricky and maybe fear provoking and maybe avoidance provoking to get back on the horse, as they say. It can be a challenging area to return to with an existing partner or partners, or if you're dating, if you're looking for a new partner. So, one way to frame this is to think about what it means to be intimate and to remember that an intimate relationship isn't necessarily sexual or isn't necessarily about penetrative sex, and a sexual relationship isn't always intimate. So, I really like this quote from the researcher Brené Brown. She says, "Stay awkward, brave, and kind." Maybe that will help us to have those difficult conversations. because some of the effects of treatment on our sexual self concept and our sexual life can be, yes, the change in our body image, can also be functional, painful intercourse. We may find it more difficult to reach orgasm, and the relationship might be impacted in different ways. Perhaps your partner has become your carer, and that changes the roles that you play and the dynamics between you, the kind of dance of relationship. Your libido might have just bottomed out completely. And we've mentioned the vaginal dryness. There can also be vaginal atrophy, which contributes to pain. So it might be a good idea to consult a sexologist if that is causing issues for you. Hair loss as a side effect of chemotherapy can be lasting. And as I mentioned earlier in the webinar, when it does grow back in, can result in really different hair color and texture. So, one of the coping strategies that people lean into is to disguise this in some way and maybe try to embrace a new sort of appearance based identity, wearing funky wigs and scarves and hats. Another thing that might change is someone's face. It can be that the face appears to age rapidly, and that might be due to the loss of estrogen when you're having hormonal treatments. It might be as a result of steroid treatments to bring down inflammation. So the dexamethasone treatment can cause this kind of moon face, this round, puffy face. There can also be side effects of treatments that include acne, puffiness, facial hair growing where it didn't used to, or the loss of facial hair, and also a kind of like cloasma type darkness on the skin, dark markings that go along with hormone fluctuations and changes too. There can also be skin metastases that lead to a different appearance of the skin, and there can be this kind of rapid aging process. So it's common for the skin and the face to change in appearance and texture. That's the bad news, I suppose, and maybe you're well aware of it if you're living with it. Let's talk about some of the things that can help. So it's not straightforward, of course, to adapt to an altered appearance. It requires psychological flexibility. And one of the kind of approaches to psychological flexibility is known as ACT. This is acceptance and commitment therapy. And the counsellors here at Breast Cancer Care, many of them work extensively using skills and activities and experiences drawn from acceptance and commitment therapy. So you can see this image is called a hexaflex, and it's a representation of the different aspects of psychological flexibility in ACT. One part of it is mindfulness, getting in touch with the present moment. It might sound cliched, it might sound too simple, but actually, in this moment, everything's okay. If you can feel into this moment, if you can be completely present, even if it's just for a breath or two, that can really help. It can help us diffuse our thinking from the things that are kind of hooked on. So if you have a kind of repetitive theme or schema that goes through your mind, maybe it's related to the way you look, or maybe it's a kind of catastrophic thought about the future, mindfulness can help to just make a little space between reality and your thinking so that you can choose to skip the track, skip the record a little bit, change those well worn psychological grooves. They're kind of neural pathways that have wired together because they've fired together repeatedly. So, getting in touch with the present moment and then cognitive diffusion, these are aspects of psychological flexibility when we can unhook from the repetitive thinking. And then where do we go from there? Well, we might then start to reflect on what matters to us, our values. And this can be done alone or it can be done with a therapist, but it can also come through in your social support. Maybe you want to talk with other people about values and what your personal values are. Your personal values might change across your lifespan, and certainly the experience of a cancer diagnosis might change what you value most. But if you can kind of connect to your values, then you might start to think about taking actions that reflect those values. So, we talked about that fear avoidance model before. This is kind of a similar but different model about taking moves towards or away from the life you really want. And particularly when life is limited, or we're very conscious that life is limited, then taking action that reflects our values might be really important to someone. So all of this can help, as can having health providers and support networks who communicate their compassion towards us, who come from a place that is trauma informed, who recognize that altered appearance is a form of trauma, who can help us with our cognitive reframing and the way that we talk and think to ourselves, our relationship with our body. And this comes through very much in trauma informed yoga, which is a particular interest of mine, whereby you can have an experience of movement that feels good in your body, and that can help your brain kind of repattern around what it is to live in this altered body. It's a different shape, it might be a different size, it might look very different on the outside, but when we move, that really helps this rewiring of our nervous system. So yoga might do that very knowingly, and exercise, it might happen with less mindfulness perhaps, but is also a really potent form of body image medicine. So I'm not just making this up. There have been studies that prove that acceptance and commitment therapy as an intervention can help with body image dissatisfaction and with weight stigma, but it doesn't help everybody. The results have been mixed. And this was a systematic review published in 2018 that analysed 6 studies that met the criteria. The findings suggest that becoming more psychologically flexible can certainly facilitate reduction in body image distress and weight self stigma, excuse me. And they also found that there's indications there that it doesn't necessarily have to be done in face-to-face therapy, that brief online exposure to the principles of ACT can also help. There's been a lot of work done using yoga as an intervention, particularly in breast cancer, more so than other types of cancer. That's my son when he was a teenager, by the way. Not everybody can pop up into a headstand like a teenage boy can. So yoga's been proven to assist, though, with lymphedema management. And typically the kind of yoga wouldn't necessarily look like that either. More gentle yoga that moves the limbs can help to move the lymphatic fluid around. Interestingly, in Annette Loudon's lymphedema research, one of the findings was that relationship satisfaction improved, as well as the lymphedema affected limb getting smaller, less swollen. They also related better to their loved ones. Yoga also has been proven to help with stress reduction, to help you manage pain. Again, that's often about this kind of rewiring of the nervous system habits and patterns. All kinds of activity can help with fatigue, but it seems counterintuitive to go out for a jog or to lift heavy things when you're feeling super tired. So, yoga can be a really appropriate kind of bridge activity where it starts out lying down and relaxed. Then you move through some postures and then you relax again at the end. So, that kind of gentle movement can really help with fatigue and getting you moving again. Yoga's mind body medicine, so it helps with anxiety and it does also help with body acceptance and this idea of positively embodying the skin that you live in. When it comes to exercise, it's potent anti-cancer medicine. It slows down the growth of tumour due to certain chemicals that are produced when you exercise, particularly when it's targeted exercise, like what you might get through an exercise physiologist or through a cancer-specific exercise program. But the other way that it helps us with altered appearance is that it shifts the focus off the body as an object and helps us feel like our body is a process. This quote is quite significant, I think. This person says, yeah, I think it's just knocked appearance off the charts because I know that I'm fit, I can do stuff, my body's working, it feels healthy, so I'm happy with that. It helps us to put appearance on the back burner a little bit and instead focus on our capacity, things that we can do. It's pretty empowering for body image. So, how much exercise do we need to get these positive effects? The recommendation is 150 minutes per week. That's moderate intensity exercise. You could do more at lower intensities, or you could spread it out across the week. So you could do 5 30-minute moderate intensity exercise sessions, or you could have it spread in different ways. But the ideal is 150 minutes to decrease risk of breast cancer and to help live well with breast cancer. Some of the ways that exercise helps is to aid in bone mineral density. It helps with balance as well, which means that your risk of falls becomes lessened. When it comes to managing weight changes, it helps to normalize appetite. If you've lost your appetite, exercise can help rev your metabolism up again and bring you back to wanting to eat. And equally, if you're trying to eat less, exercise can help with that too. It improves sleep, especially when it's done earlier in the day, sort of before mid-afternoon. Exercise will help you sleep that night. It decreases our experience of pain. Doesn't necessarily take pain away, but again, we feel more comfortable, more competent in our body. Motion is lotion. Exercise is almost always a good idea. It gives us energy. It can improve chemotherapy-induced peripheral neuropathy, which is something that's quite hard to treat as well, but exercise through, again, this neural repatterning as well as improved circulation can help. It can help lymphedema and improve our mood. You might be familiar with media personality, writer, blogger, speaker Turia Pitt. She's quite an extraordinary character and she had extensive burns. So, again, a different experience of altered appearance, but a really drastic alteration in her appearance. And I thought that these tips from Turia might be helpful. So she says if you focus on what makes you feel good, even when you actually feel like crap, that can help. Do something. Choose an action you can take right now. And that's where the movement type stuff can be really helpful to help you see your body in an entirely new way. Get out of the comparison game. Stop comparing yourself to others and focus instead on, this is her words, how bloody awesome you are. She's got this great kind of ochre way of speaking. It's very sweet. Allow yourself to be imperfect. It's okay to be insecure from time to time. And this is that kind of body neutrality. We don't have to love ourselves every moment of the day. It's okay to feel uncertain or insecure or not entirely happy about your appearance and still love yourself for who you are. An expression of that self-compassion and self-love might be in eating well. And I think most of us are pretty well versed in what eating a healthy diet ideally looks like. But perhaps again, these kinds of psychological distresses, they shift what we do. Our habits change to self-soothe or self-comfort or because we're punishing ourselves in some way. So body image distress and nutrition can be interlinked. If you focus too much, if you get kind of preoccupied, that can become a trigger for disordered eating. But if you can uncouple food from appearance by focusing on what is healthy, varied, and mostly unprocessed, pretty much whole food nutrition. The suggestion from the journalist Michael Pollan is to just eat real food, mostly plants, not too much of it. Again, really simple idea that's hard to put into action, but some ways that you might help yourself if you're interested in changing your relationship with food, because that might be a factor for you. You can have a look at the Health at Every Size philosophy. Again, it's this kind of global movement of body acceptance that says, no matter what size or shape or appearance, that you deserve to get good health care and deserve to treat yourself well and support your health and well-being. Similar but different is intuitive eating, which is more about getting back in touch with your interoceptive cues, so what you feel from the inside, rather than focusing on lists of do's and don'ts and diet plans and things that are kind of external. Come home to yourself, trust yourself to follow your own intuition about what you should be feeding yourself. And if you need support with this, the best person to see will be a non-diet focused, accredited practicing dietitian. It might sound like an oxymoron, a non-diet dietitian, but they are out there and we can help link you to them. This concept of self-compassion, again, sounds really simple, but is actually really sophisticated. It's harder than it sounds to be a true friend to oneself. But some of the foremost voices in this space, Neff and Germer, say through self-compassion, we can become an inner ally to ourselves instead of an inner enemy. Some research from 2013 here. In a study of 279 people with breast cancer, they found that body image disturbance was indirectly associated with distress, and the mediator for that was low self compassion. So it seems logical then that if we can increase our self compassion, we can decrease our body image distress. Body image disturbance and lower self compassion were associated with more psychological distress. And so this study provides evidence for a mediating role of self compassion between body image disturbance and psychological distress. We can be protective of our health and well-being by working on self compassion. It can help us adapt by decreasing body shame. This study from 2020, there were 520 participants, and the study was examining body shame and depression. Their findings suggested that low levels of self compassion increase the risk of depressive symptoms, and that high levels of self compassion are protective among women that experience body related shame. That wasn't a breast cancer specific study, it was a body image study. So, the essence then of my message to you today in this webinar is to do what you can to tend and befriend your body as it is. There's lots of factors out of your control, there's things you can't change, but you can become a better friend to yourself. Mindful self compassion gives a framework for this reconnection with your body, looking at yourself through a lens of kindness. The Buddhist teacher Ajahn Brahm says, instead of just mindfulness, we can practice kindfulness. And when we do that, we notice when the inner critic pipes up. And so we can try to speak to ourselves more kindly, and we can touch our own body as well. And this also helps the neural repatterning to give yourself a hug or to touch your own body with kindness, with a sense of wonder, with gratitude and appreciation for what it can do rather than focusing on what it cannot do, and for giving yourself some props, some love. If it's really difficult to give that to yourself, maybe it helps to imagine that you're giving that message to your dearest friend. We're often more kind and generous to others than we are to ourselves. And so I'd like to finish the webinar by guiding you in a self compassion practice if you want to do it. It's totally optional, of course. But if you feel like you'd like to try this experience for yourself, it will just take a minute or two. So I invite you to settle yourself in a comfortable position. Maybe have your feet connecting to the floor. And then to bring your hands onto your body, you could either put both or one hand on your heart, maybe a hand on your belly, wherever you like. If you're comfortable to close your eyes or just look softly down. Observe the warmth coming through the palms of your hand. Let yourself feel that warmth of tender touch. Notice your breath, observing when you're breathing in and when you're breathing out. And then in your own mind or out loud if you want to, try to give yourself these messages in a warm, caring way. If you are suffering, acknowledge that. You might say to yourself, this is a moment of suffering. Or perhaps you'll say, my suffering is real. Suffering is a part of life. Just like we would to a dear friend, we acknowledge, yes, things have hurt. There's been trauma. This is a time of suffering. And then we try to convey through our hands, through our mind, through our breath, a wish for ourselves. May I be kind to myself in this moment. May I give myself the compassion I need. Just for a couple more breaths, try to breathe that message in and out. acknowledging your own suffering and giving yourself the gift of kindness and compassion. And when it feels like enough, you can release your hands, open your eyes. So I'm going to stop sharing at this point. I'm checking with you, Mel, that that's correct. Are we done? Or are you going to come over here? I'll hand you over to Mel.
Thank you, Chandrika. Thank you for that presentation. It was wonderful, and I hope that you all got a lot out of it. I think I really like what you said about tending and befriending your body. And I think with a lot of the clients that I've spoken to, there's often that belief that because they're going through metastatic disease, that some of the feelings they have towards their body are trivial and they should be concentrating on their treatment. But obviously, you know, the way you feel about your body has huge effects on your general quality of life and anxiety levels, fatigue. So it's really, really important that you acknowledge the way you're feeling and look into ways to help tend and befriend your body. Any questions that you've got from our webinar today, or if you want linking in with any of the services that Chandrika was talking about, please feel free to contact us at Breast Cancer Care WA. Our phone number is 9324 3703. So if there are any questions that you want answered, then please reach out to us. If you enjoyed the webinar today and you're interested in complementary and integrated therapies, we have done a series of these webinars. So we've done one which is a general overview, and then one that focuses on pain and menopausal symptoms. So they're all available on our website. So go on and have a look. Thank you very much, and thank you for joining us today, and have a good afternoon.
See ya.
Bye.